Our first presenter is going to be Dr. Garrett Bullock. He is from the Wake Forest School of Medicine. And his presentation is going to be the relationship between pitch velocity and shoulder distraction forces and elbow valgus torque in collegiate and high school pitchers.
I want to thank everyone for allowing me to come today, and I'd also like to acknowledge my co-authors, which are listed on this poster. So baseball arm injuries are a significant problem and have a high injury incidence and prevalence and contribute to rise in the last decade, with the highest injuries to the shoulder and elbow. One factor that may be related to injuries is pitch velocity. Increased pitch velocity has been shown to show increased risk to ulnar collateral ligament reconstruction in professional pitchers and increased injury risk in adolescents. Due to these observations, literature has investigated the relationship between pitch velocity and elbow valgus torque and shoulder distraction force. However, there's conflicting evidence currently within the literature. For example, Laird et al. Found that there was a strong correlation between pitch velocity and elbow valgus torque in high school pitchers, but found no relationship in professional pitchers. Hurd et al. Found that there was a linear relationship between pitch velocity and the elbow valgus torque in adolescent pitchers, but Post et al. Found that there was no relationship in collegiate pitchers. These discrepancies between different competition levels may be due to different size and strength or skill efficiency within pitching biomechanics. Due to this, the purpose of this study was to determine the relationship between baseball pitch velocity, shoulder distraction force, and elbow valgus torque, and compare these relationships between college and high school pitchers. This study is part of a larger study at the Wake Forest Biomechanics lab, in which we had 70 high school and college baseball players biomechanically analyzed. They came to the lab and performed a 15-minute warm-up consisting of dynamic warm-up and then could throw to at least 120 feet within that 15 minutes. Following warm-up, they were fitted with 41 reflective markers and were advised to pitch off a regulation pitch mound with their cleats for as many pitches as they felt necessary to warm up and feel comfortable with the marker set. Outcomes for the study were pitch velocity, elbow valgus torque, and shoulder distraction force. In statistical analyses, non-linearity was assumed performing regression. However, linearity was found from this, and so a robust standard error linear regression was performed with 95% confidence intervals. In terms of findings, there was a small positive relationship between shoulder distraction force and pitch velocity, which you can see here from the scatter plot for shoulder distraction force, with a R squared of 0.32. For every meters increase in velocity for meters per second, there was an increase of 3.24% body weight distraction force. In terms of elbow valgus torque, there was also a small linear relationship, as you can see here. For every meter per second increase in pitch velocity, there was a 0.16% increase of elbow valgus torque, with also an R squared of 0.44. And when comparing collegiate and high school pitchers, there was a small linear relationship for both college and high school, and it was similar to the overall analyses. However, when comparing collegiate and high school pitchers for shoulder distraction force, high school pitchers found a small linear relationship similar to the overall analysis, but college pitchers found there was no relationship with wide confidence intervals, as you can see here, with confidence intervals crossing 0, and also the R squared of the model fit was 0.02, very small. So to conclude, pitch velocity exhibited a weak positive linear relationship with both shoulder distraction force and elbow valgus torque. However, only high school pitchers were observed to have a weak positive linear relationship between pitch velocity and shoulder distraction force, with high school pitchers not demonstrating a relationship. These findings suggest that older pitchers may attenuate shoulder distraction force with increased pitch velocity due to physical maturity factors such as size and strength, or increased pitching mechanical skill in comparison to younger pitchers. Further research is needed to understand how this relationship changes over age and how pitching efficiency and pitching skill may attenuate overall arm forces during pitching motion. That is all from me.
Awesome. Thank you, Dr. Bullock. Next, we will have Dr. Zachary Gomeyer from East Carolina University talking about the relationships between kinetic injury risk factors in the material stiffness of critical soft tissue structures in the throwing arms of baseball players. Dr. Domire?
I want to start off by acknowledging my co-authors, in particular Dr. Chris Curran, the newly minted Dr. Curran, who just recently defended. This work that we're presenting today is part of his dissertation work. He is joining us, and we'll also be presenting some more of the work on Friday. In my lab, one of the general ideas and assumptions that we've worked on, and I don't think I have to convince a lot of people this, is that the injuries that occur in pitching are often the accumulation of micro damage over time rather than an acute injury event. And if that is true, we have long thought that there should be a measure, in particular looking at the material stiffness of tissues, that might provide some insight into the relative health of tissues and as a proxy for injury risk. We have observed differences between the UCL and shoulder structures in a throwing arm compared to the non-throwing arm, suggesting some sort of cumulative change to these structures. However, we've not really ever previously looked at working to relate changes in material stiffness to things like injury risk factors. In particular, today we're going to talk about kinetics. And we're working under the hypothesis that pitchers who have high loads in their pitching motion would show some sort of evidence of microtrauma through their material stiffness and would show lower stiffness tissues. We worked with a group of 26 currently competitive adult pitchers. All of these pitchers were healthy at the time of throwing. None had UCL reconstruction. They were either collegiate baseball pitchers or professional pitchers. We did have a couple of free agents who'd been on a roster last year and were training for the next season, but all were currently active. Our measure of the material stiffness of tissue, we're using ultrasound shear wave elastography. This is something we've been doing in my lab for quite a while. You can see this demonstrated right here. It really just looks like a conventional ultrasound. And in fact, we are taking conventional B mode ultrasound. But at the same time that we're actually taking ultrasound imaging, we're also using a focused ultrasound pulse to elicit a vibration in the tissue of interest. From our conventional B mode, we actually measure how fast that wave is propagating through our tissue. And because wave mechanics says that stiff tissues propagate waves faster, we can measure get an indirect measure of the tissue stiffness. And what we get is something that looks like the right, we call an elastogram, where stiffer tissues show up as more red and less stiff tissues show up as more blue. We can place regions of interest, as you can kind of see in here, and use that to quantify the stiffness of the tissue that we're interested in imaging. For this study, we imaged the UCL, the supraspinatus muscle and tendon, infraspinatus muscle and tendon, and the biceps long head muscle and tendon as well. We also did three-dimensional motion capture, a fairly standard three-dimensional motion capture setup. We have 12 marker-based cameras and did a conventional top-down inverse dynamics approach to calculate kinetics. And then we did a correlation analysis to look for any relationships between the material stiffness and our kinetic variables of interest. To start off with, we're going to start at the elbow, and unfortunately we did not see any sort of relationship at the elbow. In fact, these are really as low of a no relationship, I think, as I've ever seen in anything I've ever collected. There really was no relationship between any of our measures of elbow kinetics and the UCL stiffness. We were surprised by that. But when we moved on to the shoulder, we actually did find relationships, particularly between tendons and our kinetic measures. So this graph here is showing the supraspinatus tendon, and this is related to the, depending on whether we're talking about an internal or external reference frame here, the distraction force that's at the shoulder. This is the mean distraction force on the y-axis and the tendon material properties on the x-axis. And you can see that with higher loads, we actually saw people have less stiff supraspinatus tendon. This is for the biceps tendon, and this is actually looking at the torque at the shoulder, the external rotation torque, and a very similar relationship. Those higher loads were associated with reduced stiffness. So these data did show a link between tissue loading and the mechanical state of the tissue, and we're excited about that. At least it demonstrated that at the shoulder. It provided additional evidence that shear wave elastography may be useful in measuring the tissue status or maybe tissue health. And maybe provocatively, this suggests that the UCL injuries or UCL health may not be related to traditional elbow kinetics measures. At least we did not see any relationship with tissue material properties. And I hope I got through that quick enough to save some time for some questions.
Awesome. Thank you, Dr. Domire. So just a heads up for all of our attendees, if you are looking at the questions in the Q&A down at the bottom, you can actually like the questions that you really want answered as well. So as you see the questions pop up, if you want to keep those questions and say like, yeah, I want this one answered, you can like those questions. So what we'll do is I'll have Dr. Bullock come back on as well, and we'll look at a few questions and just answer those as we're looking at these. So we're going to answer a few, and then we're just going to have to move on just based on some time constraints of today. So I apologize for that. The first question looking at here, so for Dr. Bullock, so first presentation, could you briefly describe how shoulder distraction force was computed?
Yes, that's a great question. And shoulder distraction force was computed with inverse kinetics, as it typically was with the 41 marker set. And then the kinetics were computed through the entire pitching cycle. And then and for this one was just maximum shoulder distraction force, which is usually right after release. So I hope that answers your question.
Absolutely. Dr. Domire, I'll give you one, and then I'll do one that can go for both of you. So for SWE, when did you capture the stiffness values, before or after throwing, and how did you account for the variability within your SWE measurement?
So the time in terms of times of season, this was a preseason setup for these pitchers, so they were in their regular throwing routines. None had thrown that day, so this is in a healthy status, a recovered status. There certainly are. We have some evidence that there are some changes based on your throwing history. We try to control for that as much as we can. We do, in terms of the variability, shear wave elastography certainly has some variability with the measurements, but we have done a reliability study of the measurements, and we're working on publishing that right now. We actually find quite good reliability of the measurements, so we're pretty comfortable that the variability is at least tolerable to be used.
Thank you. And we'll finish with one more. Again, I apologize, just based on time constraints, we want to go ahead and keep the conference moving. This question can apply for both of you. So maybe Dr. Bullock, you want to take this first. So do the implications of your study have a practical application to pitchers, and the collegiate athletes may need to be coached differently and undergo a different training program? And I think this can happen for any level, not specifically just college.
I think that's a great question. From my study, if you look at my graph, I know it was brief, that you saw that once you got above 85 miles per hour, that the variance changed drastically compared to below 85. And this is showing from a high school and collegiate athlete that how their different skill levels may attenuate forces differently, and that skill level may be able to be taught, as that Dr. Slowick talked about in his last study, and that these can help attenuate forces and therefore decrease injury risk through actual skill development.
Dr. Domire, do you want to take a stab at that as well for your study?
Yeah, sure. I mean, I think this always is a great question. What are our practical applications of our work? If we don't have that in mind, why are we doing all this? I do think some of ours are maybe a bit down the road. One of the things that we're really thinking of in a big picture idea is the potential idea that we might be able to use elastography as a means to kind of assess whether or not somebody is currently in a state that is predisposed to injury. So they have accumulated damage that really suggests their injury risk is high. And if we can actually use this, and actually as potentially as a screening tool, we could use this to potentially modify someone's training to stop an injury before it would happen. That's probably at really high level competitions where that could be employed. But anyone who's ever tried to look at doing some sort of prospective injury study can tell you that prospective injury studies, when you have to rely on injuries occurring, are really difficult to do. because you have to have many subjects in order to see enough injuries occur. If we can show that this is a good proxy for something that's affecting the tissue, it might be a really powerful way to do more prospective studies with smaller N sizes as well. And that might allow findings to trickle out through all levels of baseball.
Awesome. Thank you both so much for your presentations. And I'm sure that if there's any questions, you all can reach back out to them. But we're going to move on to our next presenter.